a challenge to dignity. Our goal was to link academics, activists, and agencies concerned with the health of refugees and asylum seekers in a spirit of collaboration and comparison, bringing together professionals working with different populations of forcibly displaced peoples, ethnic groups, and nations. The video you are watching will contain an individual presentation edited to stand alone. We hope you find them to be of value.
Dr. Donna Murphey, who is a neurologist, neuroscientist, historian of science, and community organizer. She is co-founder of the Patient-Centered Justice and Equity-Oriented Political Action Committee, Doctors in Politics. Her title is Global Health is also investing in political change of the systems that drive the harms we are made to chase. Dr. Murphy.
Thank you very much. So I'd like us to consider this title as we think about some of the issues that I will present. So many of you may be familiar with this quote by Audre Lorde. This is a statement that demands that we examine whether it is possible to in fact dismantle systems of oppression by the artifacts of those systems. When we're thinking about the global refugee crisis, we should think about what those artifacts are. This quote captures a theme that will present itself repeatedly throughout this talk, and it demands iterative reflection. Over 80 million people are fleeing persecution, conflict, violence, and human rights violations, or are internally displaced within their own countries. What mitigates harm within and beyond these countries has to do with government policies, whether they are just, equitable, sustainable, and accountable. These governments are the governments from which these people flee, as well as those in which they seek refuge. Where governments are perpetrators of the harms indirectly or directly, the work of NGOs also becomes important. Here we should also problematize the ostensible success of NGOs as the vehicle by which we perpetuate broken governments. Consider how the nonprofit industrial complex muffles the pressure for transformational change of systems. Growing our consciousness of the challenges to the health and well-being of refugees, asylum seekers, and forcibly displaced people requires that we show up with them in the face of injustice that they flee and the injustice that they fight. My experience as an immigrants' rights activist and eventually as an immigrants' rights organizer helped me to appreciate that governments can be ruthless to those who are already most vulnerable. In 2017, so this is something taken from 2017, the Texas State Legislature passed SB 4, which is an anti-sanctuary law that racially profiles Black and Brown people, separates families through the immigration detention and deportation industrial complex, and undermines health and public safety with decreased utilization of health and social services and decreased reporting of wage theft and violent crime by communities who are fearful of facing deportation in their engagement with law enforcement, the judicial system, as well as government agencies. In this op-ed that I wrote here to the left in 2017, I brought attention to the fact that there is a powerful historic correlation between anti-immigrant legislation and decreased health service utilization that should give us all pause. Congress passed the Personal Responsibility and Work Opportunity Reconciliation Act in 1996, which restricted access to publicly funded healthcare services to undocumented immigrants. Explicitly, this was to remove incentive for illegal immigration. Not only has this decreased utilization among our undocumented communities, but there has also been a reduction in Medicaid participation by eligible immigrants, including the US-born children of undocumented parents who already experience multiple intersecting systems of disadvantage. These same outcomes have been seen with anti-sanctuary laws like SB 4 in Texas, 287G agreements between county law enforcement and ICE, and the parade of anti-immigrant policies that we saw coming out most recently from the Trump administration. The second picture was of the launch event of Project Lifeline, which is a nonprofit I started in 2018. This nakedly cruel Trump administration policy of family separation created a moment to educate Americans more generally about the industry of child detention, the deprivation, the dehumanization, the toxic stress, and enduring trauma. This was in place actually for some time before the Trump administration, but he magnified the harm with over 5,000 children separated from their biological parents, hundreds of whom have not been reunited even 3 years later. This video is of a viral action, which I'll play in a second, that I helped facilitate for a good friend when Trump decided to rescind DACA based on legal pressure generated by the Texas Attorney General, Ken Paxton. Oh, how do I play this again?
Well,
My question is, why are you trying to deport me?
I'm actually just trying to make sure that the President of the United States follows and that it's up to Congress to make those decisions.
Why are you trying to separate families like mine?
I'm asking the President of the United States to follow the law.
Why are you trying to criminalize over 24,000 young people that's in Africa? DACA has provided physical and security
I'm not saying it's
stability for me and my immigrant brothers and sisters.
It's unconstitutional. What is President and you can't do that. You can't make up a law. That's what he did.
DACA has provided for me, has opened doors for me to provide for myself and my
I'm
family.
not saying it's not what I'm saying is you understand that we have a constitution. If we don't follow the constitution, it ruins the whole country.
No human is illegal. We fought for DACA and we won it. And we will protect it at any cost.
An example of how awareness of the problem is necessary, but it is insufficient, and that only action creates an attentional window that can be leveraged to build movements for change. From 2019 to 2020, I launched a forensic asylum program in Matamoros as the director of medical initiatives of Project Lifeline, where thousands of families spent months to years after being enrolled into the Trump administration policy of the migrant protection protocols, which we heard about earlier. And many of us actually more appropriately referred to this policy as the migrant persecution protocols. Physicians for Human Rights and Lawyers for Good Government, as well as Justice for Our Neighbors, were nonprofit partners of Project Lifeline in this work to mitigate the immense harm by the US government. Apart from legal and medical legal efforts, dozens of nonprofits were involved in providing direct medical and mental health relief, housing, food, and education in Matamoros. In 2021, the Biden administration is allowing for this inhumane policy to be continued, illustrating the fact that the dangers of government as perpetrator are not tied to a particular ideology or to a particular political party. There are many implicitly anti-immigrant policies that have been very problematic as well. In Texas, I was part of a group of volunteer translators and interpreters made to stand 100 feet from the entrance of a polling location in order to offer our services to voters. The rationale we were given was that we could be electioneering, which can only be done 100 feet from the polling entrance. It did not matter that we were sworn in as assistants and that we were not to engage in any kind of that activity by law, since the English-speaking polling judges couldn't discern what we were saying. We found in 2018 that the elected county clerk in charge of elections was the arbiter of whether and how limited English proficiency voters exercise their right to vote. There is a robust and growing literature on the relationship between individual health, the health of our communities, and the health of our democracy. Failure to make voting accessible to limited English proficiency voters correlates with the poorer health outcomes for these communities. In early 2021, physicians began publicly denouncing the continued use of Title 42, in some ways a functional extension of the MPP, which is also being continued, both initiated by Trump. Title 42 provides public health rationale, as we learned earlier during COVID, to bar asylum seekers from legal entry into the US. For most of this pandemic, we have allowed US citizens and other residents of the United States to move about freely in this country for business and leisure. And yet we claim that the risk of COVID is sufficient to not deny immigrants their legal claim to asylum here. Like MPP, we've also continued Title 42 under Biden. In 2017, when I showed up at my local school board meeting to educate trustees about county, state, and federal anti-immigrant policies and the value of empowering nearly half of our families in the district who are either Latinx or Asian American with information on how to navigate interactions with law enforcement and ICE, my efforts were politely dismissed. Over the next several years, I realized that the advocacy I was doing was powerful in building awareness of the harms and community strength to demand change. But if the policymakers and the executives do not hear the appeals, the leadership needs to be replaced. Thankfully, in a democracy, we have that choice until we don't. In 2019, I discovered that we had 3 of 7 school board seats up for re-election with no challengers. And while I had no ambition to run for office, I did so to ensure that our community did have a choice, to invest in the political education and organizing of our community where that was lacking, and it was lacking, and to change the narrative around school board policy as something that impacted whole child health and the health of our school communities. While I lost this election, the narrative we advanced stuck, and the youth-led organizing that we initiated grew thereafter. By 2020, something became abundantly clear in this once-in-a-century pandemic that has resulted in millions of lives avoidably lost across the globe. A combination of leaders ignorant of the intersecting public health issues, housing, transportation, education, poverty, racialized health disparities, and unscrupulous in their political motives, and social media platforms that algorithmically amplify disinformation for the attention it holds and monetizes have been the cause for the devastation that we have witnessed over the last 18 months. With the patients who we lost in unthinkable numbers and our own growing ire for the for-profit healthcare model that has extracted, exploited, exposed, and silenced our rightful outrage, physicians who understand how the dots connect between the health and dignity of all people are perfectly positioned to transform our democracy, to eliminate the harms of present systems that we are constantly made to chase. Here is the origin story of a vehicle by which we are realizing this political change.
Doctors in Politics is an organization that was started by a group of doctors who realized that in the midst of the COVID pandemic, our hospital organizations, our medical societies, and our government had no plan in which to address this issue. Doctors have gotten tired of watching the worst political decision-making happen and the destruction of a profession we really love. My name is Aisin Gwaley. I'm trained in family medicine and psychiatry. I chose to specialize in older adult mental health. People would get hospitalized and they would get better for 3, 4, 5 days after treatment. And then they would get warehoused in hospitals because there was nowhere to send them. They had gotten kicked out, or they had gotten priced out, or they had been homeless, and there was nowhere to send them, nowhere safe. Literally, I'm like, you're telling me that you want me to kick older adults into the streets? And they're like, well, maybe not that, but they can't stay here. I made the decision in the midst of the COVID pandemic, and I told people what we should do is run 50 doctors across the country in 2022. And what was shocking is how many doctors were like, yeah, we should do that. So this group of doctors who'd never met each other, who were sick of the way things were being done from all of these different specialties, came together to create Doctors in Politics. And in April, we launched our efforts, and within a short period of time, ended up in the New York Times and on NPR. This moment has shown doctors it cannot be the same. When we talk about health as doctors, we are talking about more than just health insurance. All of those things that go into that, housing, environment, gun violence, all of those things talk about what is the environment for you to be healthy. Regardless if you're Republican or Democrat, regardless of race, gender, sexual orientation, who does not want to reach their full potential? Doctors just want to make sure that that's possible. We want to make the laws so that can happen for everyone. No matter where you live in the United States, no matter who you are, if you live here, that should be a guarantee. The benefit of the patient-doctor relationship is they tell us things they would never tell anyone else. So we have insight into things that no one else has. Things that they have not shared with their family, things that they are only sharing with us because they believe we can help them. Doctors are taught to be agreeable, to find compromise, to find solution. It turns out that disagreeability has really no other, it's not an asset anywhere else other than business and law. And those are the people who go into politics. So the reason why we have this crazy bipartisanship is, of course, the people that are there are rewarded for disagreeability. And so what I care about is putting doctors into office who can collaborate, look at data, find solutions, come up with ideas. Doctors have never organized like this before. This is new to us. Organizing to win political power is new to doctors. We have done advocacy groups, but really going for seats of power, changing the conversation is new. The person we are waiting for is us. It's not someone else. We have been waiting for us. To help our patients, we have been waiting for us. It's us. And if we don't come together, if we do not organize, if we do not pull our resources together, right? No one is coming to save us. They didn't come to save us in the pandemic. They're not going to save us now.
So in our inaugural cohort, I wanted to showcase 3 candidates. These were from 2020 for whom their advocacy in immigration and their identity as immigrants has informed their leadership as policymakers. Dr. Eve Kreef is the first of these. She found family separation during the Trump administration horrifying and organized 7 to 8 vigils in her community, rallies as well, to demand accountability and to build public awareness around this problem. She wrote letters and op-eds, and prior to family separation, she admits that she was not at all involved in this area. In 2021, Dr. Kreef ran for the Harborfield Central School District School Board, and she won. Her work has motivated her advocacy for undocumented students and families in her community, many of whom are recent asylum seekers. She states specifically that the students often need additional emotional support. She asks questions of the school district of how they can provide trauma-informed care, where children often are without one or both parents, with one parent or both living in a different country, or not knowing one or both parents. The concerns of school board members have to be addressed by their superintendent, and Dr. Kreef leverages this in order to ensure that specific resources are offered to these families to help them navigate distinct challenges. Equity in language access to educational opportunities, technology, connection to social services post-graduation, pathways to job training and jobs is a priority. And this is also as a function of her experience doing this kind of advocacy work. She says that if nobody cares about this, the schools do their bare minimum as required by the state. So she is the voices of these families on that board. Dr. Michelle Au is the next person I wanted to profile briefly, and she is she is a first generation Asian American woman who is the first Asian American woman to serve on the Georgia State Senate. Her district has a very large immigrant population. She knows that disentangling the work of immigration enforcement and law enforcement in policies like 287G agreements is really important to her constituents. These agreements really do prevent them from having a safer community because they're worried about basically having to engage with law enforcement. With immigration if they report anything to law enforcement. So just as an example of one of the things she's done in the last session of the state legislature, she motivated by the Atlanta shootings, if you guys remember, in March of 2020 or 2021, I guess. A group of Asian American legislators, among other things, tried to increase language access to translation with officers of the peace. Our third candidate, he was a candidate for Congress here, is Dr. Pritesh Gandhi, who did not win his congressional seat, but was arguably a win for the broader goal that we have in Doctors in Politics for changing the narrative and driving compassionate and evidence-based policy in appointed positions. So Dr. Gandhi now serves as the Biden-appointed Chief Medical Officer of DHS. He's probably one of the more contentious people that I'm profiling here. For those of us who are interested in global health, as he perpetuates a system that does generate these harms that we are then made to chase, as I've framed it. He's exquisitely aware of this conundrum, and he demands that his colleagues keep him apprised of what is happening on the ground, as that eludes him. He's no longer a practitioner or advocate on the ground, and he expects to be held accountable. So I want you to consider this critically. In March of 2021, and this is information that he provided to me, with a large influx of unaccompanied minors, unlike the prior presidential administration, Dr. Gandhi was able to work with Biden to lead a team of physicians who did clinical rounds to ensure that the immediate health and safety of these children was maintained. In Del Rio, just a few weeks ago, he was able to mobilize 150 clinicians into a makeshift arrangement, set up water and latrines with his background in complex humanitarian emergencies, and to implement SPEAR standards. While Biden and Mayorkas may have received appropriately scathing feedback on the massive swift deportation of these Haitian immigrants, largely Haitian immigrants, it's hard to argue that the immediate health needs of these families were unaddressed by Dr. Gandhi's efforts. With refugees in Afghanistan, pushing through a mandatory measles vaccination campaign was important for averting a major measles outbreak that would compound the many challenges that these families already face. Oops. Okay, sorry about that. So I just wanted to show here a couple of the stats that we have on the doctors who we've recruited to run for public office with our political action committee. And I wanted to say first that crisis creates moments of clarity and potential for transformation. And the answers to our existential questions often lie in that crisis. So here right now, we've started this political action committee, and we've recruited over 100 doctors to run for public office. Over 45% of them are doctors who have decided to run because of the lack of mask mandates. So these are very local offices that they're running for. Local and state. 24% of the physicians who are engaging with us are people of color. 71 of the doctors who have decided to run for office of the slightly over 100 are women as well. So this is the moment that we're in. If you guys recognize this, it's from Del Rio, the Black migrants there just a month ago being corralled like animals and swiftly deported to a country that many of them fled a long time ago, or some of them are not even from. And here we have our colleagues in medicine who were not personally untouched by racialized systems, with a disproportionate number of us, healthcare workers who died being immigrants, and also people of color. So I wanted to leave you with this quote by Arundhati Roy. You all may have read this when it first came out in the Financial Times, but I think it's very poignant. What is this thing that has happened to us? It's a virus, yes. In and of itself, it holds no moral breed, but it is definitely more than a virus. Some believe it's God's way of bringing us to our senses, other that it's a Chinese conspiracy to take over the world. Whatever it is, coronavirus has made the mighty kneel and brought the world to a halt like nothing else could. Our minds are still racing back and forth, longing to return to normality, trying to stitch our future to our past, and refusing to acknowledge the rupture. But the rupture exists. And in the midst of this terrible despair, it offers a chance to rethink the doomsday machine we have built for ourselves. Nothing could be worse than a return to normality. Historically, pandemics have forced humans to break with the past and imagine their world anew. This is no different. It is a portal, a gateway between the one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us, or we can walk through lightly, with little luggage, ready to imagine another world and ready to fight for it. Thank you very much.
Questions from participants? Comments? Oh, Olga.
Yes. Well, thank you so much for this presentation. I was going to ask something in the past presentation, but it ties very clear. And I think the answer, you give me the answer to the question I had, which was the sense of agency that doctors can have amidst, like, in the face of these constraints, political constraints. but you have shown a very clear example of all the work that they are doing. And I just was thinking, which are the challenges as well, because Tom's presentation was focused on how they feel and preparedness for what they found in the shelters, but then turning into another field, which is politics, which is a big field full of new information for doctors. So which are the challenges, but also the interdisciplinary approaches, other specialists supporting the movement, lawyers, or other people more like trained in politics that is being part of this movement as well.
Yeah, so I mean, there's already a huge political infrastructure, right, that helps to recruit and run people for political office. Lawyers vote much more than doctors do. Lawyers run for political office and occupy political office much more than doctors do. And we are leveraging that existing infrastructure. So Doctors in Politics, for instance, has partnered at the very beginning of our existence with 314 Action and with Run for Something. These are political action committees and nonprofit political organizations in order to train our doctors to successfully run campaigns and then to successfully govern once they're in office. So we're definitely leveraging what's there of people who are kind of ideologically like-minded, right? We think about things in terms of health, right? All policy is health policy to us. And so anybody who's on the same page, then we try to ally with them because they've already been in the space and can help to provide us some guidance. Physicians are bad about being politically engaged. I think that a lot of us feel that our service to society is through the care that we provide to our patients, and that is exhausting in and of itself. And so as discussed before, it's hard to ask someone then to above and beyond that to be engaged politically, but this is our social responsibility, right? And I think that if we think of it, if we reframe and think of it as like, that's just part of what we do as physicians because it aids in providing good care to patients to ensure that all of those social determinants of health are appropriately addressed, then I think it's a better sell. But yeah, I mean, right now, only 40%, somewhere around 40% of physicians who are eligible to vote even vote. So now getting them to run for office, it's like, I mean, it's kind of some people think that we're just out of our minds, right? But it's apparently resonating because there are physicians who have started showing up at school board meetings because of the COVID mask mandate bans and other things having to do with COVID. And they're beginning to realize that the way that power is handled in the community is not in service to the people that they serve as their patients, right? And also they suffer from it because physicians who have, for instance, spoken out against their hospital systems during the pandemic or for-profit care and what that's looked like for us in trying to manage this pandemic, they have been penalized, right? There's been retribution against those physicians. So there's a lot of energy now, I think, for people who, are very angry to put that somewhere. And this is a really productive place to put that energy. Yes.
Yeah, thank you so much for your talk. And thank you for Doctors in Politics. It's very important work. So my question is that I sometimes teach medical students on the social and political determinants of health and ultimately arguing for the role of advocacy for their role as future doctors. And not all of the time, but I would say probably once in every classroom setting, there is a student who kind of pushes back and says, well, this is not the doctor's place. This isn't my responsibility as a doctor. My role is to focus on the clinic within the four walls and not so much out in the community. And so I was just wondering, obviously you've been talking a lot about the role and the importance of it. And so in many ways you've already answered it, but what would you say? I mean, how often do you come across that kind of mentality amongst students or doctors? And then what would you kind of like push back on that?
Yeah, I think it's very common, unfortunately. So like we're kind of socialized in medicine to believe that you're right, that exactly what you said, that our role is to take care of patients in the exam room, and that we shouldn't be bringing our political ideas to any of the conversations that we have, but like we're inherently political beings, right? And everything that comes to bear on the health and well-being of our patients actually is impacted by policy, right? Which politics has influence over. And so I think now actually we have there's an organization called Future Doctors in Politics. And it's a group of medical students out of Harvard. And they were kind of inspired by our political action committee work. And so they created this other organization that's a C4 nonprofit. They're trying to change the way these conversations are being had at the medical school level. So trying kind of upstream to make sure that people who are in medical training understand that that's actually a part of what they're responsible for doing when they go out into practice.
Okay, thank you very much.